Hi everyone, it's Dr. G. Welcome back to the Sociology Experience. In this video, I'd like to talk about health and medicine. Health is as much a social as a biological issue. Let's take a look at some definitions. Medicine is the social institution that focuses on fighting disease and improving health. Health is a state of complete physical, mental, and social well-being. Society affects people's health in several ways. Cultural patterns define health. Standards of health vary from culture to culture. People in any given society may believe that something is healthy or not only based on the issue within their own culture. Cultural standards of health change over time. Specific beliefs and/or practices can be redefined after years of conformity. A society's technology affects people's health. The invention of new technologies can make old diseases obsolete while creating new ones. Social inequality affects people's health. The rich have far better physical, mental, and emotional health than the poor. Let's take a look at health and medicine in the U.S. The U.S. spends more on healthcare than any other country in the world. And on the slide in front of you, you can see several different countries listed and how much they spend on healthcare. Notice on the far left-hand side, the U.S. spends the most. And on this slide, you can see that over the last many years, healthcare costs have been soaring within the U.S. Healthcare is one of the largest for-profit businesses in the U.S. There are billions upon billions of dollars of profit annually. And on the slide in front of you, from a Forbes research study, you can see that at the very top of the list, health technology is an extremely profitable industry. And further down on the list, health services is also listed as quite profitable. The number one reason that Americans declare bankruptcy is due to the inability for them to pay their healthcare bills. The U.S. is the only high-income country that does not have universal government-sponsored healthcare for its citizens. Approximately 9% of all Americans do not have any type of health care insurance at all. And on the slide in front of you, you can see that back in the early 2000s, the percentage of uninsured was actually much higher than it is today. But unfortunately, research projects that the number of uninsured will start to go back up again. So while major healthcare providers and industries are getting extremely rich on profits, people are losing their wealth because they get sick. Epidemiology is the study of how health and disease are distributed throughout a society's population. Age: it is rare in the US for a young person to pass away. Gender: women have better overall health than men. Social class: higher income people get better and more medical care treatment. And race: people of color in the US generally have more health problems than Caucasians, and this is generally due to high poverty rates among people of color. All right, so that's it for health and medicine. Thanks for joining me, and I hope to see you back soon. Bye-bye.